Are you wondering why exercises like knee hugs, pelvic tilts, or even those core exercises you're doing are not helping resolve your lower back pain? Well, I'll let you in on a little secret, and it's all about how our lower back works and then how it becomes injured. Most of the time, and maybe even yourself watching this video, you've injured your lower back bending down to pick something up, maybe carrying something, maybe putting the child seat in the car or the shopping in and out of the car, or maybe even bending down to put your socks on or shoes on in the morning. And if that wasn't the original cause of the injury, it's definitely a site of recurrent flare-ups. It catches you out and sets you back off, maybe at the start of the day or partway through the day, and just flares that whole thing up. Whether it is just back pain or sciatica, the reason for this is simple. It is rounding and forward bending. A feature common to those exercises I mentioned first and foremost, the pelvic tilt, the knee hug, the invariable use of crunches and exercises like that round the lower back. They do three things, and these three things are why it doesn't help your lower back and why it's not the right thing to do to resolve lower back pain or sciatica for that matter. And that is, number one, when you round the lower back, you flare out and disengage the sacroiliac joints. Many people with lower back pain will get it on one side or the other, and often it's confused or misdiagnosed or cross-diagnosed with sacroiliac injuries, and that can cause things like sciatica or just local back pain. But when we round the lower back, we disengage, provide less stability to this region in the sacroiliacs. Number two is that by rounding the lumbar spine, just like you did maybe when you injured your back in the first place, you compress through these lower lumbar discs. Now, whether you've got a profuse herniation, a raging disc bulge out to the side diagnosed on MRI, or whether you haven't got that formal diagnosis, you've just got back pain and maybe it's something else or been diagnosed something else, all back injuries will involve some degree of load-bearing injury to the discs, whether it's minor or major for that matter. It's going to impact those discs and strain them. And that means, and it's very easy to identify this, it means that loading, compressing onto those discs is going to re-aggravate, re-flare up that very first problem because you're replicating the scenario that caused the injury in the first place. And the third thing is by rounding your lumbar spine, you put the lower back into a flex position and put it into a position which it is not particularly able to effectively load bear. When our lower back is ready to brace and take load, lift something, etc., we want to have a nice strong lordosis. That puts all of these joints in their most biomechanically efficient position to bear load. And if you're routinely doing exercises that are compromising this position, like sit-ups, even though you're trying to strengthen the core, you're doing the wrong movement and you're going about it the wrong way. Or if you're doing knee hugs, you're doing all of those three things routinely, disrupting the natural healing process that is trying to take place in your lower back. And that fundamentally is why those sorts of exercises don't work. And if you've been going round in circles, doing those things over and over again and not finding they're getting any results, then make sure you click the link underneath this video to learn more about the Back in Shape program and how we structure things to actually adhere to the fundamentals of the way in which your spine works and the way in which it gets better. And you'll also find out why we've got everything from GPs to dentists using and recommending the program, as well as even other osteopaths and chiropractors referring their patients to the Back in Shape program to get the help they need from home to complement the work they're doing in their various clinics. Click the link underneath this video, learn more, and get started today. You've got everything you need to fix your back from home.